Women with an often painful and stress-inducing illness known as uterine fibroids are choosing a minimally invasive procedure to treat it instead of surgery. In tonight's Health Check report, how the procedure works and why one patient says it changed her life.
Lay here, and then...
At least 35 million American women have been diagnosed with uterine fibroids. These non-cancerous tumors grow in the walls of the uterus, causing heavy menstrual bleeding and pelvic pain.
So for bleeding symptoms, we mean heavy menstrual bleeding, or periods that are more prolonged or frequent than what's typically been normal. Some women may have such heavy or prolonged bleeding that they become anemic. The bulk-related symptoms are caused when those fibroids grow large enough that they start pressing on adjacent structures in the pelvis.
Megan Chisholm thought these symptoms were just her normal. She'd suffered since she was a teenager and needed help.
Oh, definitely some relief. I was willing to do just about anything.
Hysterectomies are typically performed when other treatments won't help fibroids, but that's a major surgery that many women don't want.
But a lot of women really don't want to have their uterus removed. So for these women, uterine-sparing treatment options like uterine fibroid embolization become an area of real interest.
Interventional radiologists, including Dr. Megan Chang with Baptist Health, are now working to promote this lesser-known alternative. Uterine fibroid embolization is performed entirely through a small catheter.
That catheter is then maneuvered into the blood vessels that supply the fibroids, and then through that catheter, tiny particles about the size of grains of sand are then administered into those blood vessels supplying the fibroids.
Those particles act to stop the blood flow to those fibroids, which in turn causes the fibroids to shrink. For Megan Chisholm and so many other women, this procedure has given them a faster, safer, and easier way to relieve their symptoms.
The long-term benefits I have gotten from it have literally changed my life. I've been able to resume doing activities that I love to do. I can go out and enjoy social evenings, and it's been very, very beneficial for me.
Dr. Chang says about 66% of women have at least one fibroid by the time they're 50 years old, and that some women may have them and just not even know it. For those women with no symptoms, no treatment is necessary.